Cue music.
All right, good morning, everyone. I hope everybody had a safe and happy new year. My name is Jacob Ladner, and I serve on the City Council, represent District 5, and I also serve as Council President. As most of you know, Mayor Bowling tested positive for COVID-19 last week, so I'm filling in for him. I have had conversations with him. I talked to him last night. He's feeling much better, but he's focused on resting and getting better and getting back to work. So he will be working remotely in any scheduled meetings he has scheduled this week. He will be attending virtually. So today we're honored to have Decatur Morgan Hospital President Kelly Powers with us, Alabama Department of Public Health Assistant Administrator for the Northern District, Michael Glenn, and Jenny Ferris, the 911 Director, is joining us as well. I'll give a brief update kind of on our numbers, and then we'll turn it over to Jenny. Today we have 9,471 confirmed cases and another 1,557 probable cases, bringing us to 10,974 cases. Our 14-day percent positive rate is still increasing and now stands at 57.78%. So 3 out of every 5 people that are tested for COVID-19 in Morgan County will be positive. Again, over the last 14 days, we've added 1,642 cases, which is now 17% of all the cases we've had in Morgan County. So our cases continue an upward trend, and we hope we can move that down. We do expect with the holidays we just had that those probably will continue to increase, but hopefully we'll start seeing some good news, start seeing those coming down soon. We did invite Jenny Ferris, the 911 Director, as with us today. As most of you experienced on Christmas Day, we woke up with the news out of Nashville that there was the bombing happened there downtown, knocked out a lot of AT&T telecommunications networks were down, phones were down, and the mayor invited Jenny today so she could kind of talk through what to do if that were to happen, if you weren't able to, if you didn't think you could contact 911, and then a couple of other things. But Jenny, go ahead.
All right, thank you very much. Appreciate allowing me to be here. And yes, Mayor Bowling asked if I could come and speak with you guys today a little bit about the explosion in Nashville and AT&T's outage and how that did or could have affected the 911 system here in Morgan County. We were very fortunate with this incident that our systems, as far as at the center, did not go down. We did not experience any of the outages for our working systems. This is mostly on a customer basis for those people who had 911 service through AT&T or one of their networks that they support. One of the parts of it that became a large concern was our ability to receive calls, 911 calls from those AT&T customers. One of the important information to get out is that even though the cellular system was down and your AT&T phone or service phone may not have shown service, there's a good chance that you could still call 911. When you dial 911 from a disconnected cell phone from the service, it still goes through because it will go to another carrier's network. And this is just a fail-safe part of the 911 system. So we were receiving information, or we were receiving 911 calls from AT&T customers during that time, even though they may not be able to call each other or even send a text message out. One of the pushes that we tried to get out to people also is if you have Wi-Fi calling, if you are able to get on your Wi-Fi network, even if that means like at a McDonald's or a Walmart or some other local agency that has free Wi-Fi, you can turn on Wi-Fi calling, and this will also give you another option to be able to call for emergency services. Another option that Morgan County is fortunate to have is we do have text to 911 service as well. When you pull up your text messaging, you just type in 911 and then type in your message, and we do get that at our center. This service is an internet-based service, and many other counties around us have this service as well. So as long as we have internet service, then we are able to receive your texts to 911 as well. We did not have AT&T's internet service, and so this was a service that we still maintained during the outage. when you do text 911 or call 911, the most important thing that we need is your location. When the outage occurred, we could receive calls from 911 through your AT&T phone, but we did not get location information. And same thing with the text messages. When we get them in, we need to know your location. So please be patient with us if we don't move on with questioning, because we have to have a location. If we don't know where to send help, then the rest of the information is just not very good for us. So please be aware that we're going to get that information as to where you need the help at before we are able to do anything else. If we had a situation in Nashville, whenever this went down, it actually did take out Nashville's 911 system. They weren't able to receive calls at their center. In these types of situations, what we're going to do is we're going to see if we can find a phone line coming into the center that does work. If it's not 911, if it's a regular landline or non-emergency number, then we're going to push that information out. So please be aware that social media is going to be our biggest push to get this information out. Our next will be to contact the local news agencies and try to get that information to as many people as possible. As part of your home plan, for like a tornado plan or any other emergency plan, it's good to familiarize yourself about where some of your emergency services are located. Your closest fire station, if you know where your police station is, anything that would be close enough so that if you cannot call out to get help, that you know where to go right away. Because if your service is out, there's a good chance that your Google may not work and you may not be able to find that fire station or police station if you do need help. So please include that in your plans whenever you're working on your emergency plans, as far as where is your local or closest fire station to you. One last point that I was asked to go over a little bit about the 911 call process itself. When you dial 911, of course, the first thing we're going to get is your location. And then after that, we may be asking you some questions or getting some information from you. Please understand that this is not slowing down your service. When we're asking the questions of you, we've already sent help. As soon as we have your location and a brief idea of what's going on, that ambulance, fire truck, or police officer, they're already starting that way. So us asking you questions is not slowing them down. When it comes to medical calls especially, there is information that we may ask you that we're giving the responders so that when they get there, they have the ability to triage and to help you actually a little faster because they have an idea of what's going on. We also have the ability to give some pre-arrival instructions. So while your loved one or yourself even is waiting on that emergency services to arrive, we can give you some instructions that can actually help save lives and make it a little easier when the responders get there to be able to get you, you or your family, your loved ones, the help that they need. So whenever you do call, please be patient with them. The questions that they're asking are pertinent and they are important for us. So on a final note here with this, again, thank you for allowing us to speak with you. Please remember that your 911 is for emergencies only. We do have other numbers if you have non-emergency services needs as well.
Thank you, Jenny. That's great information. Obviously, we would never plan or hope that something like that would happen, but if it does, great information to help our residents. And thank you for 911's something that never stops, 24/7, 365. So thank you for your service, your and your team's service to our community.
Thank you.
All right, Kelly, update from the hospital.
Yes. I'm happy to announce that our numbers are down some. Not happy that it's due to a lot of deaths. We are down to 79 positives. We do have 14 presumptive patients, which puts us still at 93. But we had a high last week of 96. So being down to 79 is a little, less stress on our staff. We have 12 in the ICU, 2 presumptives in ICU, 9 on the ventilator, and 1 presumptive on the ventilator. So all in all, down, but again, I'm sad to say that some of it's down due to patients expiring. We have 41 employees that are positive and 51 self-quarantine at this time. So still a lot of employees out and continuing to see that positivity rate in the community. It does alarm us for a week or two from now that we'll probably have another surge from the holidays.
Have we started to see that surge from Christmas yet, and then New Year's possibly as well?
I think we started to see a little bit of it in the community. but not people having been hospitalized yet. I am hearing this morning of a few admissions of people who found out maybe a week or so ago that they had it, and they're coming back and being hospitalized, so.
Do you have any update? I know last week, I think you talked about, you've had a lot of employees at the hospital have gotten the vaccine. Is that still kind of continuing vaccination?
It is. We actually had our clinic the other day, and we administered 159 doses. We had more people scheduled, but some didn't show up, and some couldn't get it once they were there. There's some clinical reasons why you don't want to get it, especially if you've had COVID in the last few days or so positive. We're doing the booster clinics January the 6th. The people that got the first Pfizer vaccine from Athens will come back and get their second shot. And then we'll have another one on January 12th from Athens. And then we will continue weekly to vaccinate as many people as we possibly can once a week. We've looked at doing it more. It just sometimes stretches the staff that we already have to do it. So we're still working through that, but hoping to get as many people as we can vaccinated as quickly as possible.
And then you mentioned last week too, the monoclonal option as well, and have people been taking advantage of that?
They have, actually, and that is a great thing. So again, I want to tell everybody, if you find out you have COVID-19 and you're not sick enough to be hospitalized, there is an outpatient monoclonal therapy infusion that we do. So please contact your physician and see how you can get that if you meet certain risk factors with that. But yeah, we've seen a lot of success, I feel, keeping people out of the hospital.
Yeah, I know Mayor Bowling wanted me to share. He had his yesterday,
Yeah.
so he seemed to have a lot of success with that with different folks. So
Yes.
Anything else right now for you? Thank you for the update from
Thank
the
you.
hospital. Michael,
Yes, sir.
glad to have you with us today.
Glad to be here. Thank you for the opportunity to come and give an update. You've all heard the numbers this morning. Morgan County continues to rank number 5 in the state. That's not a place that we want to be as far as positivity rate. Continues to go up. We're been concerned. Public health sounds like a broken record every time we come. We're concerned, and we are. We're greatly concerned with the number, not only of cases in the community and in North Alabama, but also the hospitalizations, as we hear. And as we heard this morning, sometimes as the numbers go down, it's not always for a positive reason, for a very sad reason. Thankful that the holidays are over. We have just got, for the lack of a better word, we've got our teeth kicked in over the holiday seasons. I ran some numbers just to kind of give you a little idea of where we were and where we are right now. As the holiday season fall kicked off on Halloween, we had 959 people statewide in the hospital on Halloween. Just 4 weeks later, after we did our fall festivals, trick-or-treating, social gathering of that, at Thanksgiving, it went up to 1,450 people in the hospital statewide. We did our Thanksgiving holidays, traveling, those kind of things. Christmas Day, it went up to 2,403 people statewide in the hospital. We did our celebrations at Christmas, family gatherings, things of that nature. Yesterday, it was 2,885 people in the hospital. That's not a total in the state of hospitalized patients that are currently in the hospital for COVID-related reasons. Those are a tremendous amount of patients, a tremendous amount of strain on our healthcare system. And as we've talked about this morning, we don't fully believe that the full ramifications from Christmas and New Year's we've seen yet. So January is going to be a very probably difficult time for the hospital systems and for public health as well. But on a good note is all the health departments in North Alabama started vaccinating last week. We will continue to do that on a weekly basis as long as we have the available staffing. That's going to be a big chore. You hear that the hospitals are having staffing issues. Public health is the same way. We have employees that are have either tested positive or have been a close contact for people. So staffing in general is a huge concern for us as well. We continue to get another allotment of vaccine this week, and so we've got scheduled clinics this week in each of our county health departments. We are focused on our high risk 1A right now, which is our frontline health care people. And so those people will take priority even as we open up other sections for people to be vaccinated. Those frontline health care workers will continue to be a priority. And so what I would say, if you are a frontline health care worker and you have not received your vaccine yet, either at the hospital or you've not known about the health department, and even I believe Payless Pharmacy in Decatur got some vaccine last week. I believe they were scheduled to. I don't know that for a fact, but you can even check. We just want you to get a vaccine wherever you can get it at. And so if you are a healthcare provider, what we would ask for you to do is that somebody from your facility reach out to your local county health department, and we will give you the information to schedule your whole team at one point, rather than having each individual person trying to call the health department to schedule a vaccine. We're doing on appointments as well for a number of reasons. It helps people not have to congregate so much, everybody rushing in first thing in the morning to get a vaccine. Plus, it also reduces the amount of time that somebody has to stay at the health department. And so we'll try to give you the paperwork ahead of time so that can be filled out before you get there and get your vaccine quickly, and try to get you out in a timely manner. Other than that, I don't have anything, but I'm here for questions if you have anything.
Is there, testing seems to be, we seem, if you want to test, you can get a test.
Absolutely.
Yeah.
Our testing demand at the health department is up. As you bring that back to my attention, as I passed by one of the urgent care centers on my way here, they were still lined up outside at 9:30 waiting to be tested. And so there's a tremendous need for testing in the community, or tremendous demand. And you heard the positivity rate between 57 and 59% over the last 14 days of all reported tests have come back positive. And so there's a lot of community transmission. And just to piggyback on this virus is not a respecter of persons. It's not a respecter of buildings. And so it doesn't matter that or what your job title are, or what your job responsibilities are, or where you are. We need to continue to wear our masks. We need to continue to social distance wherever we are, and continue with a good hand hygiene that we have continued to pound and pound week after week, month after month since this pandemic has started. And so please, wear your mask. Stay at least 6 feet away from people that are not in your home on a routine basis, and wash your hands and your work areas routinely.
Thank you, Michael. So I think hearing from everybody today, in the next few weeks, it seems likely we'll continue to see an increase. So please, for the hospital's sake, our family members, our friends, our community, continue to take the precautions that Michael mentioned. You know, wear your mask, wash your hands, social distance, and especially if you're feeling sick, get a test, stay at home, stay quarantined. Our next press conference for COVID-19 update will be next Monday, January 11th at 10 a.m. and we will take some questions.
Yeah, so I wanted to ask, I don't know who would be the best person to answer this, since we have not yet seen the effects of the Christmas and New Year holiday, or at least not in full effect, what are your concerns in regards to, like you said, that there is a concern for proper staffing as well as resources whenever we do start to see the full effect of that?
Well, I guess my concern is that my ICU will begin to fill up again, and that I'll have more patients on ventilators than we can handle. One thing you've seen across the United States is where they start rationing resources. I do not want to get to that point. I hope we don't have to. As a system, we can, share and transfer patients around, but that's my biggest fear, is that we have patients that need ventilators or medication, and we just don't have any. So I am worried about that.
And then I know you said that the numbers have gone down, not for a good reason, because
Right.
of people dying. Have you seen the death rate in general go up?
Yes, in the hospital we have. I don't know about the county and how we're keeping up with that, in our county, because some of our patients are not from Morgan County. So, but yes, we've seen the death rate in the hospital go up.
And then, whenever we do see the effects of the holidays, do you think that that's going to probably be the most, or I guess the record numbers that we've seen overall, and how do we get control of that after that?
I think that the same thing we've been saying all along, we need to get as many people vaccinated as we can, but also people need to do the right thing, wear their masks, social distance. Now that the holidays are over, please stay away. I'm sure Judy would say that over and over again this morning, as Michael has said it, but please stay away from your family if you have it. Try to adhere to the things we're asking you to do, and let us get through this. I think January, I feel like mid to late January is when we'll see that next peak.
And then last thing, Tell me a little bit about that process, and then also, is that available to anyone who wants to receive that?
No, there's certain clinical criteria that you have to meet, but they're pretty, simple things like, I think, if you're over 65 and you have hypertension, if you're under 65 and you have some health conditions, it's just based on what your physician, if you have some health conditions that, show you need to get that. It is a limited supply, so it's a first come, first served basis. So we are not getting near enough. So we just have to, we get, maybe 50 or so doses a week, and that's about it. We have borrowed through the system and shared with each other when we have patients that need it. But I really believe it's been a good thing and kept some people out of the hospital.
And you get that through your physician, right? Your
Yes.
physician orders that.
You
Yeah.
come to the hospital and get it as an outpatient infusion. So the physician just calls, their office would call to schedule you at the hospital to receive that infusion. You're welcome.
Lauren, are you there? Lauren, are you there? Lauren Harkson from WH&T. She wants to know how many doses of the vaccine you've administered versus how many you anticipated you were getting. Did I say that correctly?
Okay. We received 1,800 doses last week.
1,800.
Half of that is slated for the healthcare workers. We did give out 159 of those doses last week, and we anticipate giving out, I'm not really sure exactly how many she has scheduled for this week, trying to get all of the healthcare workers vaccinated by the end of January.
Okay, you have a follow-up. Are you satisfied with how many doses the area is getting so far?
Right now I am. I'd love to see, I think there's some local pharmacies, the health department, other places are starting to get them. And so, yes, because I don't have enough staff to take away from patient care to focus on vaccinating everyone. So it's great that the pharmacies and the health department, other people are helping us give the vaccine.
Have any other questions? They're asking if any more details about Mayor Bowling, where he might have gotten it, or how he's doing.
As far as where he might have gotten it, I don't know that he would even know that. But I've talked to him, and feel free if you guys have. He seems to be in really good spirits. The phone conversation was no different than I've ever had with him. So I know he's, is trying to stay active. He's has a lot of confidence, I think, in his primary physician, has given him a good plan, and I think he expects to be back at work once his physician allows him to be, but seemed in really good spirits. But Kelly, if you talked to him.
Yeah, I did yesterday, and he received the infusion, and he said he felt good.
Yep.
Any other questions?
One other thing I would like to mention is, keep in mind when you get the vaccine, that does not mean that immediately you are protected. It takes, Michael,
2 weeks.
2 weeks, or even, well, maybe a little more.
Yeah.
I would stretch it to maybe 18 days or so before you have built up any immunity to the virus. So there has been people and things on the news that say, oh, I took the vaccine and then I still got COVID. Well, yeah, you probably didn't wear your mask or do what you're supposed to, and so you don't have those initial antibodies until after, I would say, 18 days, just to give you a little bit of cushion there. So please wear your mask, social distance once you get the vaccine.
Lauren, Lauren has a question for you about the rise in the homeless numbers, apparently close to doubling here. What it might be the reason and where these people might be coming from?
Yeah, obviously that's an issue, but I do not know where they may be coming from, so I'm not sure how to answer that.
She said there's speculation they're coming from larger cities, and if you had any thoughts on that.
Yeah, I can't speak to that because I don't know that that's the case. So,
That's all. Thank you.
okay. I know the question came up about number of vaccines, or we feel like we're getting in North Alabama, anything there?
Well, it's definitely based, not only in Alabama, but nationwide, the allocation's based on population. And so the state gets an allocation, and then it's divided down according to county population. And so, yeah, I think right now we're doing okay. We'd always like to have more, but even if we had enough vaccine today to give everybody in the county a shot, it will take time to get everybody vaccinated. And so again, just please try to schedule your appointments. Keep those appointments, and we want to get shots in arms to get people protected as quickly as possible. But in the meantime, please wear your mask. Please stay at least 6 feet away from each other, and wash your hands and your work areas routinely. All of these steps are ways to break the infection chain. If it can't get introduced to you, then you can't get sick. And what I'd say, even piggyback on this, is if you are symptomatic and you feel that you need a test, or if there's some reason to alert you to go get a test, presume that you are positive until you get those results back. That doesn't mean to go into the grocery store and run errands for the day or go back to work. If you got a test, presume that it's positive, go home and quarantine so that the spread is reduced. One of the reasons that community spread is such a big deal right now is because we go get tested and we just keep about our daily business. And so please, if you need to get tested, please quarantine until you get the results.
I do have some text from Mayor Bowling. He says, we encourage all who have tested positive and have been cleared to donate blood to do so. That will allow for more of the monoclonal. And he also says he has no idea where he received the virus.
Okay. I can repeat that so everybody can hear. First off, Mayor Bowling sent a couple of messages in. He doesn't know where he got the virus, but also had encouraged everyone to give blood, and that helps with the monoclonal infusion supply. So, okay, I will thank you for joining us, and thank you, Jenny, for joining us as well. I think one thing all of this has taught us is we always appreciated our healthcare workers, Department of Public Health, and the hospital. But this is a whole new level of appreciation, so thank you to your teams for the past year now that have really been leading us through this. So hopefully we'll get them some relief soon. So that's it. Thank you.